Hello, everybody. It gives me immense pleasure to welcome Dr. Divya, who has secured rank 1 in the Pediatric Neurology INISS exam. So, the Apex rank in the Apex exam in arguably one of the most competitive fields. So, when you're targeting super specialities, especially in pediatrics, we know that there are times when there are zero seats also sometimes in certain branches in certain institutes that you target, and over and above that in a field like pediatric neurology where there's such a huge competition by default, most of the students I know that who are looking to do something specialized, super specialized in systemic pediatrics, most of them are targeting peds neurology somewhere or the other. So in that, getting your topmost rank with now all the choices in front of you, how does it feel, Divya?
It feels good actually. I've been waiting for this for a while. Now that it's been almost 1 week, I think finally it has sunk in that okay, it is me only who has gotten this rank. Thank you. Thank you for the introduction.
Yeah, so like before we go into our preparation, tell me a bit about your branch, pediatric neurology, and how did you make this decision? What made you like this particular branch?
Okay. So basically, I was very clear after UG that what branch I want for PG. I was very sure that I want pediatrics only. But the same was not true after finishing my MD in pediatrics or during the time that I was finishing my MD in pediatrics. Like I was very confused among two, three branches. I just knew what branches I don't want. Like I did not want to take neonatology. I did not want to take critical care. I did not want oncology. So I was sure what all branches I did not want, but I did like two three things that I was interested in pursuing. I was also not sure whether I should be doing some DM or I should do general pediatrics, because that also was a confusion at that point of time. So my first attempt, I gave nephro just because it was one of the branches that I thought was suitable for me. So initially I'd given nephro, but I did not qualify in the attempt as well. That was during my final MD exams. Then when I finished MD, then in the first 6 months I took a break for 6 months. So during that time, I kind of like thought about what all options I have in hand, and then finally I decided that neuro was the best for me. So that was only in the first 6 months after MD that I decided. The thing that I
So
thought about was, first I always felt that neuro was a very intriguing subject. Like not everyone is able to diagnose, or there is some kind of fear associated with neuro somehow. Like everyone tries to refer those patients off to the specialists. It feels a little intriguing, the diagnosis. Even though maybe the management part might be mostly symptomatic as of today, which might improve in the future. But the diagnosis part was very intriguing. It was an elusive kind of this thing, which I liked. That was the
so
reason.
like yeah, delving a bit deeper, like from a third person point of view, like if somebody is thinking, like somebody's in your shoes, just finished MD, still a bit confused. Most of what I have seen is that it's similar, right? People have this notion of, okay, I want to do systemic pediatrics, but then I'm confused among those branches. So what would you say, like what are the pros and cons of pediatric neurology?
Okay, so the first thing was that there is a lot of patient flow. Like even if you see in PGI or in any of the major central institute or state college OPDs for that matter, in a general OPD day also almost 50, 60, 70% of the patients are having some or the other neurological complaint. So if you are first thing is you should like the branch which you're taking. Some kind of interest should be there in that particular branch. That is the first criteria to try to choose one. The second for me was that it was more of a OPD. Matlab, I had a lot of option in OPD. Like there was a lot of variety of cases that you could see in an OPD basis, with not so much inpatient or so much deep critical care kind of perspective. I didn't want to work in those 12-hour shifts. If like neonatology or critical care for that matter, where most of the patients are sick, you have to work long shifts. I didn't want to do that, and I felt that neuro, I like the subject, and it was more of an OPD practice. There was a lot of inflow from OPD side, so I felt that it was a perfect fit for me. So someone who wants to be a little more towards the OPD side, doesn't want to delve too much into the critical care aspect, wants to see a variety of cases, yeah, they can choose this. But if they are very worried about the outcomes, like in critical care and neonatology and all, you have a very satisfactory outcomes many of the times. So you treat a patient, they get well soon, so you can see that outcome, the probably
Gratification.
the yeah that yeah the instant gratification that you get is more in these branches. In critical care, definitely you do one PD or you do one HT, you do some intubate, ventilate, and the patient would come out and recover and come out of it. So for people who feel so many people I have talked to have always felt that neuro was a branch with not much prognosis. It is a very morbid, like there is a lot of morbidity associated with it, but I never felt like that. I felt that even those kind of patients, they uh, like maybe a few years back there was not much to do for any of these patients, but now that now we can see that there is much more improvement in the diagnosis, much more improvement in the new therapies. So maybe in the next few years it would definitely improve. It wouldn't be as morbid as it is today, and we can see that in developed countries it is not so. So that was also one thing. I always felt that these patients also, they had to be respected, and they also had to be given at least a basic quality of life that they deserve. So I always felt that. So for people who don't have problems with this long term management, long term morbidity, because parents also need that sense of satisfaction, some mental peace, some closure, we should also be
Assurance.
able to help them in many ways. So for people who want that instant gratification, who feel it is too morbid, they shouldn't come into this. But if you feel that you can help them not only just by diagnosing or treating only the problem, but all the associated things, give them some quality of life, give them assurance from your side that you're always there for the patient, they should try to choose neuro. Other than the diagnosis part, which is very interesting.
Somewhat similar to my own branch, rheumatology, where that instant gratification may be not there.
Is
The
not there.
chronicity is always there. The patient never really says ki, oh, I'm completely all right.
Well,
But yeah, the other things, add up to the positive side of it. And also, kind of giving that conservative and long term care also, like especially when it comes
mm,
off, adds a different level of satisfaction when it's such
yeah.
a long term thing. So, like, I know that you were kind of targeting AIMS Delhi Peds Neurology, but you might have also had an eye on where pediatric neurology seats are there. So, just for our listeners' information, can you just kind of map out a bit on where seats are in the country?
Yeah, yeah. Actually, I was very surprised that the number of seats all over the country was quite less compared to the demand that this particular subspecialty has in pediatrics. Like I said, there are lots of patients. Even in a general OPD day, you would see so many patients who are who want neurology specific care. I mean, considering that the number of seats is quite less. So, among the central institutes, only AIMS and PGI used to have seats initially, but now it has come up in AIMS Rishikesh as well. But all of them barely have one or two seats per session, sometimes even zero in some of these. Like currently in this session, there was no seat in Rishikesh. There's only in AIMS Delhi and PGI. In the last session, there was no seat in Delhi. So among central institutes, only these three have seats as of now. And in NEET PG, which I also gave last year, there were options in CMC, MMC, and Trivandrum Government Medical College, and one more Jawaharlal Nehru College in Belagavi, Karnataka, I think. So 4 states.
There are almost
Uh,
no DM seats in north of
no,
Karnataka, I
yeah,
think.
no, yeah, no DMCs in North India. In not even, I mean, yeah, not even the
DNB
and
seats.
like yeah, DNB seats are also not there. Surprisingly, that was a bit of a surprise for this branch.
So, like, again, let's kind of go back, and I kind of forgot to ask you for your introduction to our listeners. Can you just tell us from where you are, and then where did you do your education? Then we can go on to how your journey of your prep was.
I finished all my schooling till 12th from Andhra Pradesh. Then I did my UG batch of 2014 from AIMS Delhi. I passed out in 2019. Then I immediately secured a seat in MD Pediatrics in PGI Chandigarh, which I did from Jan 2020 to December 2022. Then I passed out in 22 December. I took a almost 6-7 months break after that, And currently I'm working as a senior resident in Department of Pediatrics at AIMS Delhi itself for the last 9 months.
So how was your journey of preparation was right from your decision that okay, I'm giving pediatric neurology, both general peds and neurology in specific.
Yeah, so first I have this is my third attempt of neurology per se. So I've given two attempts previously, and I'm actually thankful that I was able to reach the stage two in both my previous attempts as well. So that helped me quite a lot, especially in the departmental assessment part, to understand what they really ask. It kind of reduced my fears of an interview, to face new faces or to face new questions. So the first time around, I asked around a lot of people who were my seniors how they went about the preparation, and everyone was mainly of the opinion that Nelson is the Bible for the preparation. So everyone said that you should be very thorough A to Z from Nelson, both the major sections, nervous system as well as neuromuscular disorders, which I tried to do in my first attempt. So I could finish my first reading, and I could make good amount of notes from that Nelson read for my first attempt. That was all I was about to. That was all that I could do. I couldn't revise much. Maybe once I had revised, and I couldn't do those extra topics, those extra edge topics from other books like Swime Neurology. Even the people did tell me that some topics have to be read from that, but I did not have the time to do that at the time because I decided quite late. It was almost March by the time, almost Feb end by the time I had decided that I should prepare, and I had barely 2 months with me at that point of time. So my first attempt was okay, half-hearted, but I got into the second stage as well. I gave the interview. I got somewhere around fourth or fifth, I think, in the first attempt. So that kind of gave me some assurance that okay, it's not impossible to get into that this thing. If you just try a little bit, you will be able to secure a good rank. But my second attempt again, that time I was in a busy posting, hectic posting. I couldn't devote much time. Also, there were no seats in Delhi. There was only one seat in PJMR and so much competition. And when I joined SRship, actually, I found out whoever I used to ask or whoever I used to find out, everyone was interested in pediatric neurology. Everyone wanted to write pediatric neurology, and everyone had given one or two attempts of pediatric neurology. That also kind of scared me a little bit. Oh my god, there's a lot of competition. Like even neonatology or critical care, which I thought were the most sought after branches. But I didn't see so many people actually say that they wanted neonatology or critical care. Many people rather said that they wanted neurology. So that also kind of scared me for my second attempt, because here we are playing just a game of one and two. You either get one or two maximum. Like, and this thing kept on decreasing over time, right? So in MBBS we used to target, maybe if you want to get names in first top 36, then it became top 10, then it became like literally one. You can't get anything else, or this, like, there's no value for even a third or a fourth rank. It became very stressful at that point of time. So second time also I couldn't prepare as much, but I did reach again the second stage, gave a decent interview. Again, I got, I think, third or fourth in the second attempt as well. So this was my wholehearted attempt. I gave all of it, all in this time. So yeah, so basically, because I already gave two exams by myself, I gave two interviews by myself, I pretty much knew what were the areas. So even though the whole of Nelson is important to study, but if you see the old question papers, I kind of figured out what are the areas which were their favorites. So I this time around, I just it was only a revision for me predominantly. Only a few new things that I had to read, but predominantly it was a revision for me because I had made some good notes over the last 1 year. So I just used to see the old questions, go back to those parts of my notes, read it again, try to remember. Then I had a separate page where I wrote down the things that I easily forget, which are very volatile, like genes and like for example, yeah, mainly genes and a few mnemonics, some things that they have no logic in them, but you have to remember them because they come as questions. So those things I could make a separate page for that, and I could see only that one day or the day on the day of exam before going into the exam hall. I just saw those so that I could remember those things. So mainly it was Nelson. A few things like epilepsy and neuromuscular, a few parts of neuromuscular I did from Swinman. and yeah, old question papers. That was how I went about the preparation for the stage 1. Stage 2, again, because I had given those, thankfully I had given those 2 attempts in which I had reached up to the interview. I kind of knew the questions that they asked. Like, they concentrated mainly on some clinical scenarios, um, in both the time and this time as well. So what I felt the first 2 times was, even though some things are there in your mind, you're not able to put it through in the interview, especially neuro, where differentials are a bit difficult to come out of your mouth. Like, I felt that it should be already there in your mind, that this, if this kind of case comes, these should be the differentials, you should be listed in your mind prior to you start to tell them. So
You
that
shouldn't
was a
try to
difference.
articulate
Yeah,
them then and there.
at the moment, yeah, it's not something that can come organically. Like other general pediatrics differentials, for example, for pneumonia, something like that, we are more used to telling those. Like, we because we see more cases, or I don't know, like, it
It's
is slightly
essentially
difficult
about
in neuro.
thoroughness. Like,
Yeah. So it should be in your mind before you try to speak it out, because at the moment, if someone just pops a question, it is very difficult to run through all the differentials in your mind and then give it in the limited time that they give you to answer. Also, there's a lot of pressure in the interviews, that there's a time limit. You're also very scared, anxious most of the time. So I felt that it should be there in my mind. I should be preparing accordingly. Like, if they ask me approach to this, I should be able to delineate this. I should be able to say that this is the reason I'm thinking of these things. So I try to practice that more. And always they ask advances, because this is a branch where advances matter the most. Like in rheumat, like, all the new things have changed the course of these diseases. So I knew that naturally that they're interested in asking about recent advances, the new drugs that were approved, and so on. So I also prepared in that line. So that is what helped me. I think that was about it.
so now you have obviously entered the world of pediatric neurology. So, like, for again, for a guidance perspective, for someone looking at a potentially becoming a pediatric neurologist in the future, how do you see the branch going forward? Like, how do you look at the practical aspects? We have already touched upon it a bit, but again, kind of reiterating it. How do you, what do you think about that?
I think this is a brand that is going to grow by leaps and bounds in the future. Like, you can see how a few years ago everyone thought nothing can be done for these kids. It's just sad that they were born with these diseases. You just have to live with it. It was a huge burden on the parents, and so on. So from that, the scenario has changed rapidly over the last few years. Even so, this is not the case here, maybe, but in other developed countries, you can see that even prenatal diagnosis, even for a diseases like SMA, where gene therapy has been given even in a pre-symptomatic stage, and the child is completely fine, developing very well without any issues, like the child never had the disease. So it has grown from somewhere that SMA was always a death sentence in a few years back. Now it is almost like, if you can find it out at a pre-symptomatic stage and treat it with the gene therapy that is available. I mean, yeah, obviously it is relatively new, so we have to follow them up for a few years to see whether they require it again or not. But still, it has shown quite an improvement. So I feel that this is a branch that will grow by leaps and bounds in the future, and with the amount of treatment advances as well as diagnostic advances, there is a lot of scope in this branch. So there will be a lot of demand for this branch. There is already a demand. There will be a better, there will be a lot of demand in the future. So if people who are interested in the subject, who are interested in treating such patients, who are interested in the chronic long term care of such patients, they should definitely take up this branch, because it is going to be one of the top branches. Like neonatology is right now, this is going to be the next big thing, is what I feel. So you should take, if you really have the interest for the subject, you don't feel that it is very morbid, or it is not very depressing for you per se to see such kids, then you should definitely take it, because it does show a lot of, even small things, like a small things that you treat in these kids can make a huge difference in the life of these kids as well as their parents. So once you create that bond with one parent, they will definitely want to come back to you again and again, because they formed that rapport with you, because you treated one small thing that actually was disturbing their whole life, even a small thing that helps in the quality of life of the patients. And maybe in the like in the next, I think already in private setup there's a lot of like interconnection, I mean, intercommunication with the psychologists, therapists, and all those, which is probably not that developed in a government setup, but already coming up in private. So once you establish a good team of psychologists and therapists, you can really make a difference in the lives of these patients, and they will always be your chronic I mean, they'll be coming back to you again and again. So you have a good patient base, and even if you want to start practicing in a not a very metropolitan city, even if you want to do in a tier 2 city, if you have a good team, I think it is a branch which is always going to give you fruits of your labor. So yeah, that's what, if you're interested in the branch, you take it.
Thank you for guiding the students. And yeah, so final word of guidance, especially with respect to the preparation aspect, we've talked a lot about the branch on who should choose it. With respect to the preparation, like there are some mistakes that the usual mistakes that students do. And like, would you like to kind of chime in on them, what not to do and overall what to do?
Yeah, I think so. Everyone does read Nelson, and everyone reads a little bit of Swayman as well. The mistakes that we do are mainly not doing the whole question papers at least 4 or 5 sessions. So that is one thing that can make a difference in your final outcome. So even for the general part, if you see, the questions are quite predictable in the sense from the same areas. They're interested in a few areas, and even in general, if you
Topics.
can't, yeah, a few topics, a few areas, which if you find out and then make a note of it, and if you do that and go, it makes a huge difference in the theory marks that you get. And theory is the one part where you can make that difference between you and the second or the third person. That is completely an objective thing, so there is no influence of anyone else in that. And if you make a huge difference in that, it does make a huge difference in your final marks. So that is one thing I think that people tend to forget to do. They're a little scared to do the old question papers, thinking if we do the questions, then we will be scared as to the number of. If we don't know something, we'll be like, oh, I did not read this, I did not read that, I prepared very less. But even if you prepare very less, but if you do the old questions and go, you'll have at least a good amount of edge over the other people. So that is one mistake which people can avoid, doing the old question paper. So in this place, only all the apps and the teachers come into play. I think the faculty of apps and the question banks of the apps, they help you to revise these like short,
Previous.
short, hot topics, new things that can be asked, and so on, especially in the general part as well. So since they have gone through a lot of question papers themselves, so that is one thing that people can do to avoid this mistake in the future. And another thing, yeah, only on the day that you decide you want it, that is the day that you will get it. So you should be wholehearted in your preparation. You can't be like half-hearted. Like my first attempt and my second, I was confused whether I should do only general pediatrics. So once I joined SRship, I had a good exposure of few months in SRship that I decided finally that okay, I'm happy with doing DM now. So the day that I decided that I wanted it is when I actually prepared the maximum. So that is another thing. So you can't go into something half-heartedly. It doesn't work like that. So that is also another mistake. People are confused. I feel like you can take some time. Just don't go with the peer pressure that everyone is writing something. Especially from central institutes, we see a lot that if all of our batchmates are writing some essays or the other, so we also feel like going towards it. So even the day when you don't get under all this peer pressure and decide for yourself, even if it is the 1 year away, 1.5 year away, 6 months away, but that is the day that I can actually make a difference in your preparation. These are
Yeah,
the two
like being
mistakes.
a general pediatrician is definitely fine. Like obviously there's a lot of scope there as well. But then we should not be in like, two boats at a time.
Yeah,
Either be a general pediatrician, like
or
learn well all the things that are needed for that, or like, jump onto that particular DM prep and then go on to do.
yeah,
Yeah. So again, congratulations. And like
thank you.
finally, I'd like to ask you if you would want to thank anyone among your friends, family, obviously. Who would you like to thank?
Obviously, my family, my parents, my in-laws, my husband, they all really supported me in this journey. They actually motivated me. They had more faith in me than I had in myself. In all these attempts, they always said, "What is there? Even if you're third or fourth, you will get that first, whatever you want." They were the main support, the pillars of my support. So yeah, my family. And God, whenever He thought that I should get it, I think that is the time. This was the time that He thought I should get it.
Sure. It was very nice talking to you. Finally, like I myself, as a family friend and senior, was very happy at the result. So it's a great time. Congratulations again.
Thank you. Vishnu sir, actually, I wanted to say that he was a very important figure for me when I did my MD. I was very confused whether I should join MD Pediatrics in my first attempt or give another attempt. He guided me well. He was my go to person for all of those 3 years. Thank you, sir.
Sure. Okay. Thank
Okay.
you.
Should I leave?